Hey guys, it's Jeanette. Hope you're doing well. This is the second video related to pregnancy. So I'm going to talk about my personal experience being pregnant and working. So the day I found out I was pregnant, I actually was at my job doing an ultrasound IV course. And I remember not wanting to participate. And I'm glad I did, just, because I didn't want to be exposed to the ultrasound. And it was just funny how that just kind of worked out. I was on my way home, and at that time I've only been working for maybe a month or two, and I remember being really tired and just busy, and I didn't realize that I had missed the start of what would be my menstrual cycle. So after the IV class, it was only maybe half a day, I somehow decided to go buy a pregnancy test. And not like I was feeling any type of way. If you've watched the other video, I was kind of used to thinking I was pregnant, taking a test, and then getting depressed when the test came back negative. So buying a pregnancy test was kind of now the norm. So I snuck into my guest bathroom. My husband was home, and I peed on the stick. And I waited 2 minutes, and I was in there, and I'm like, it can't be positive. I've had so many that are negative. So I went and leaned over, looked at it, and there were 2 lines. And at that point, I forgot how to read symbols and words and everything. So I looked at the box, and I just kept going back and forth. Is it 2 lines, you're pregnant? 2 lines, you're not pregnant. 2 lines, you're pregnant. I was pregnant. I couldn't believe it, and I couldn't wait to tell my husband. I was thinking about ways that I could surprise him, and our 5-year anniversary was coming up. So I already had kind of a photo shoot scheduled just to take pictures on our 5-year anniversary, and I kind of turned that into a pregnancy reveal announcement / 5-year photo shoot. Yes, like I mentioned, I didn't have any initial symptoms of nausea, vomiting, other than just being tired, which I thought was work related. Being a new nurse is really exhausting. There's so much that you're doing and that you're learning, so I just didn't think much of it. When I found out I was pregnant, I was about 4 or 5 weeks, and I made my appointment to go visit the doctor and get a confirmation. So after I got the confirmation from the first ultrasound, I went and emailed my manager. Before then, I did tell my preceptor, because me and my preceptor got pretty close, and I was telling her my journey in trying to conceive, and she was very supportive, and I was also trying to get her input on her thoughts about being pregnant and working as a nurse, because my plan of getting pregnant, having a baby before working as a nurse, didn't work out. My manager, I told her via email, I was a little scared, I'm not gonna lie. I didn't know how management was going to feel. I was one of the new nurses they just recently hired. 2 months into the job, I get pregnant. At one point in my life, during nursing school, before I got this job, that was one of my fears, being pregnant during my first year of nursing. And they were very supportive. So early on, my manager knew. Therefore, I felt comfortable. I could turn to someone in regards to just safety and keeping them updated. So throughout my entire pregnancy, I kept them updated, and they were happy. Thinking back, like before, when that was one of my fears, fast forwarding and having gone through that recently, they are supportive. People, it's funny, the first day on the unit, there's another Jeanette. It said Jeanette's baby shower. And mind you, again, we've been trying, and my first day on the job, I walk into a staff room that's decorated with a boy-themed baby shower with my name on it. I'm like, weird, can't wait to tell my husband, maybe it's a sign. You just never know. Other than that, the nurses were supportive as I progressed during the pregnancy. They were helpful. They tried to like turning patients. You know, my nurse techs were always reminding me, stop doing that, or, you know, ask for help. And I'm always like, let me do. So they constantly had to remind me to slow down, just because they knew all the stress that I felt, you know, the baby would feel. So they were supportive. Nurses, like if I needed extra help or getting caught up on something, if they were available, they would be more than happy to help. My nurse techs were awesome, so awesome, with just general support, but as well as like physical support. Like, what can I do for you? Can, you know, do you want me to turn? Can I get you something? I really, really was appreciative. And it made the pregnancy part of work easier. I worked all the way until week 36. Man, okay, so this goes, it was tough, y'all. I'm not gonna lie. As an ICU nurse, you're constantly on your feet. You're constantly doing things for your patients. I remember towards the end of my pregnancy, and mind you, I was heaviest I've ever been in my life. That really made an impact on what I was feeling. I remember just almost like in tears. There were days I was in tears, like had like mini contractions. I had days where I was afraid something was happening, and I would just be in the bathroom, like calling my husband. I called my doctor during the middle of the shift to report some symptoms and trying to figure out what was going on. One thing that I didn't enjoy was, I don't want to say putting myself at risk, but I didn't like how that is. I mean, you're a nurse. I'm there to take care of my patients. And having this baby, like, I would hate how tired I was. I would hate having to push a stretcher down to go get a CT. I would hate feeling like I'm not taking care of my own body because of my profession, and that I was working and I had patients who needed me. If I were to become pregnant again, I'm not sure how long I would work as a nurse, because I felt like I should have enjoyed that pregnancy more. Yeah, sorry. It's bringing back a lot of emotions and feelings. Working as a nurse while pregnant is tough. Physically, it's very demanding. What you can do to make it better, if you can, I don't know, save up your PTO, get off it a little earlier. Maybe you can ask for light duty. Maybe you can float to a different unit if it's too busy. I wish I could have sat more. There were days that I couldn't. I would leave the hospital limping. It's tough, but I got through it. A couple of my other nurse buddies got through it, and you know, our bodies are super strong. They can handle a lot, but that being my first pregnancy and my first baby, I just wish I enjoyed it a little more. So the big symptom that I felt early on was just fatigue. I was super sleepy. I was still taking my nursing courses online for my bachelor's. I just felt like I was taking on too much. So I stopped taking my nursing courses maybe October of that year, and I was due in December. So some tips for you if you are pregnant and working as a nurse. Try to find the best shoes that you can wear. Compression socks or stockings that go all the way up are a must. Drink lots of water. Try to sit as much as possible. Elevate your legs. I remember getting really swollen just being on my feet, plus being pregnant. And I ended up not scheduling shifts back to back September through November. My body just couldn't do it. So try to maybe schedule yourself to be on and off for a couple of days and then on again. It was tough and annoying for other people, but your health comes first. Your baby comes first. I ended up saying, you know, I can't work back-to-back shifts anymore. And then it got to the point where I went down to 2 times a week. I forgot to mention that I was seeing a high-risk doctor. My baby girl was diagnosed with like poor fetal development, and so the entire pregnancy, it being my first pregnancy, as well as her measurements were kind of behind and she was losing weight at one point. That was really stressful. I wish this was a more positive video, but I wanted to really share my personal experiences. Back in my mind, every time I went to work was, how do I keep myself safe? How can I rest a little more? How is she doing? Am I the cause of her poor development? And it was tough, and there were days I didn't want to go to work. I'm about to cry. I don't know. On top of that, you have emotions and hormones. It's an experience, and again, like I mentioned before, having support from your spouse, your significant other, even some nurses and the nurse techs and managers really does make a difference. I remember this code. I call the code neuro, and by that time I was probably 7 months pregnant. And if you don't know, you call a code neuro. There's a team of nurses that come with you. Someone's calling the physician, someone's doing the overhead paging. I'm literally disconnecting her from whatever's on the wall so I can wheel her down to get a CT. So I remember doing that, and in that moment, it was just a reminder, it's not about me, it's about my patient. And during the pregnancy, it's tough because as a first-time pregnant woman, I didn't know what to expect in terms of my own body. Having a baby that's already showing some type of, I don't want to say complications, but why aren't her numbers coming back within the normal range? But at that moment, I remember wheeling her down, and that's who I was taking care of. I forgot I was pregnant, and I was rushing, and I was pushing, and I was, it was a lot. And I told my husband, if we have a second kid, I might need to take a longer break from working just so I can enjoy it a little more. Being a nurse, you know way too much, which doesn't make the process any easier. I worried about every single, almost possible thing that could occur, and that's not healthy at all. So I had a very hard time enjoying my pregnancy because of all of the worries. I guess that's about it for my own personal experience. I did get induced on week 38, so I stopped working the day after Thanksgiving, which would be week 36. So I had about a week and a half to just get everything else ready and, get admitted to the hospital to get induced and have my baby girl. I know this video, I felt like it was all over the place. I hope it was helpful. If you have any questions, feel free to leave it in the comment section below. Don't forget to comment, like, and subscribe and share the videos.